Okay, thank you for joining us. My name is Jillian. I'm one of the nurses here at Northwestern. I'd like to tell you a little bit more about what you need to know about the kidney and pancreas transplantation program here. I'd like to refer to your Transplant Handbook. This is an excellent resource for any questions that you have about today's appointment, as it discusses kidney disease and the transplant process. There's also a sheet with SRTR data on it. That shows our outcomes compared to the expected outcomes. Patients can go to the website, www.srtr.org, to look up the outcomes for any transplant center. I'm going to tell you a little bit about the evaluation process. Evaluations are expected to be completed within 12 weeks. Sometimes scheduling takes longer, and we are aware of that and will work with you. All patients are assigned to a transplant nurse coordinator. It is your responsibility to schedule your testing and be in communication with your coordinator. Any testing our physicians order is required to be done at Northwestern. If you do want to complete the testing at a hospital closer to home, you can ask your nephrologist or primary care physician to order that testing for you, and then make sure you talk with your coordinator to get the results sent over to us. The evaluation process has 3 components. That is the medical and surgical component, psychosocial, and financial. For the medical aspect, you will undergo a history on the telephone and a physical in person with one of our physicians. Based on your personal medical history, we will order further testing and consultation as part of your workup. All patients will be expected to be up to date on their basic cancer screenings. For example, your pap smear and colonoscopy. If you have already had that testing done, we'll be able to request the records, and you do not have to repeat that as long as it's up to date. For the psychosocial aspect, we need to ensure that you have adequate support to take care of you post-transplant. And for the financial portion, we'll discuss expenses related to the need for lifelong immunosuppressive medications. For waiting time, if you're currently on dialysis, your waiting time goes back to when you began chronic dialysis. If you are not yet on dialysis, your waiting time will begin the day that you are listed. You have to have a qualifying GFR per UNOS policy. When you are placed on the list is based on when you complete the evaluation testing and are approved by our selection committee. Your nurse coordinator will notify you when you are placed on the waiting list. You are not automatically placed on the waiting list after today. Additional information: you can multi-list at multiple centers. That can be beneficial based on different waiting times and different criteria per transplant center. Where you complete your transplant, or where you are transplanted, is where you must complete your follow-up. Northwestern is a Medicare-approved facility. It is a federal crime to buy or sell organs. You can opt out of any kidney offer at any time. This will not affect your place on the waiting list or future organ offers. Thank you.